I'd like to tell you a story of a young woman I know that didn't have health insurance. She worked at a little pizza place around here, and she was pregnant, worked, of course, for minimum wage. She went to a hospital, and the hospital told her that she needed $100 up front, which she didn't have. Of course, didn't make a lot of money, so they had billed her a couple times for it. And after getting pregnant, she went back, like I say, went back again. They told her she needed $100, which she didn't have. And so they refused to see her because she had a bill and stuff from being there before. So she went to another local hospital, and they seen her and stopped her labor and told her to come back in 2 days. Well, before she got back, within those 2 days, her baby died. So they life-flighted her to a hospital in Columbus, and within 15 days she died. And they come to find out that it had misdiagnosed what the problem was, and it was a smaller hospital, didn't have the needs to take care of what she needed at that time. But her family and them think that if she'd have had good insurance and stuff and was taking care of at the first hospital, of course, that had the medical needs to take care of her, that her and her baby, of course, would still be here. And that's just, I think that the health insurance thing really needs to be addressed, and for people, that work for minimum wage and different things.
Well, I hear so many stories like that. People without insurance are more likely to die than people with insurance.
Yeah.
And, it's not only just a terrible tragedy that something like that would happen in our country, but by the time they airlifted her to Columbus and tried to save her life, think of all the money they spent.
Right.
And if they had taken care of her in the first instance, they might have avoided it.
You to consider just one small but tragic example of why we must do this. I was campaigning in Ohio a few weeks ago, and I was in southern Ohio, down on the Ohio River. It's part of Appalachia, and it was a poor part of the state. And I was meeting with a group of people in a mobile home. And a deputy sheriff told me about a young woman from that town who had worked at the local pizza parlor. She worked for minimum wage. She sure didn't have health insurance. She got pregnant. She started having trouble. She went to the nearest hospital. There wasn't one in her county. And the hospital, whom I do not blame, said, we can't take any more charity care, particularly from out of the county. So before we examine you, we've got to have $100. Well, you might as well have asked this young woman for $1 million. She went back home. She came back a little while later, still having trouble. They told her the same thing. Next time she went to that hospital, it was in an ambulance. She came in through the emergency room. The doctors and the nurses tried very hard, but they weren't able to save her baby. And she was so bad off that they had to have her airlifted to the nearest big city, Columbus, and taken to the medical center. And for 15 days in the intensive care unit, doctors and nurses worked heroically. But she died. And as I was listening to this story being told, I was just aching inside. It is so wrong in this such a good, great, and rich country that a young woman and her baby would die because she didn't have health insurance or $100 to get examined.